For Body Chemistry Associates and Health Connection Radio, I'm your host, Jay Foster. Well, the month of May is Arthritis Awareness Month, so I want to talk about arthritis and inflammation. I'll start out and end with this comment. If you have arthritis or inflammation and you have any cow's milk protein in your diet, try getting off of it for 3 to 4 weeks and see what happens to your joint pain or other inflammation or arthritic symptoms. And there's two reasons. One is that the dairy products are way too high in calcium, enough calcium to build a frame of a 1,200-pound cow. And also the cow milk protein casein, which is in all milk, cheese, yogurt, and ice cream made from cow's milk. It's not in butter and not in heavy whipping cream, the liquid heavy whipping cream, not the spray can, but the liquid heavy whipping cream available at major markets. So you can use the heavy whipping cream, you can use butter, but the cow milk protein casein can lead to inflammation and in the joints or anywhere in the body, and all the calcium is way too much from what we see. People build up calcium deposits for that. So rather than having to take the drug anti-inflammatories, you might want to try your diet first, and then we'll give you some natural anti-inflammatories as well. So modern medicine treats inflammation historically with steroids or with non-steroidal anti-inflammatory drugs. And the steroids have a lot of side effects, including bone loss, osteoporosis, muscle weakness, destruction of the hip joint and other bones. Triglycerides go up, diabetes can be precipitated, shakiness, tremor, high blood pressure, all kinds of different symptoms. And then if you cut it too quickly, then the corticosteroids, you go through withdrawal with your adrenal glands, and you can have weakness and depression and joint aches and headaches and tiredness from going off it too quickly. That's like why they give an Amedrol pack. They give it in decreasing doses so you don't have a complete collapse of your adrenal glands, but it's still a problem. Even the non-steroidal anti-inflammatory drugs have problems associated with it, and most doctors don't know this. Archives of Internal Medicine in 2000, way back in 2000, but it's a reliable medical journal, the Archives of Internal Medicine. Consumption of NSAIDs and the development of congestive heart failure. And they said that you are at much higher risk for heart failure. Individuals had used NSAIDs in the previous week, just a week, had a 200% increased risk of hospitalization for congestive heart failure compared to non-users. That's without heart disease. In history of heart disease, the use of NSAIDs in the week before was associated with a 1,000% increased risk for hospitalization for congestive heart failure. Now, Pfizer, who makes Celebrex, conducted a study with Cleveland Clinic, and Pfizer had all the controls over everything, and they came out and said it did not cause heart disease, but since they were making it, I don't believe that one at all. So there's natural ways to fight inflammation. Inflammation, the drug anti-inflammatories work on the enzymes that promote inflammatory chemicals. You might know that Celebrex is a COX-2 inhibitor, and it has a dozen side effects, including heart disease, dozens of side effects, I should say. And there are natural ways to inhibit COX-2. And so COX-2 is cyclooxygenase, and LOX is lipoxygenase, and both can be inhibited by natural compounds that wind up working like natural anti-inflammatory agents. For instance, for COX-2 inhibitors, and the drug manufacturers kind of lied to Congress about this, but the COX-2 inhibitors have a lot of side effects, and there are natural ones, like curcumin. Many people are discovering the benefits of turmeric or curcumin. We have that in our CRP formula, and it not only lowers inflammation in joints, but it lowers the inflammatory marker in the blood that's a risk for heart disease, the cardio CRP. That's why we named it CRP formula. Just 2 tablets twice a day does an incredible job. Also, ginger affects inflammation on both sides, and green tea. In fact, Tazo, I think they still make it. They make a green ginger tea that has both in it, and that would be good for inflammation. Also, for LOX inhibitors, Boswellia serrata, we've got some natural formulas in our office that we use with our clients that have Boswellia in it. That other name is frankincense for that. So inflammation can cause a lot of problems, not just in the joints, but certainly in the joints, and not just in the heart, but certainly in the heart, but also certain forms of cancers and Alzheimer's even may be influenced by inflammation. So we can test for this kind of thing in our programs of Body Chemistry Associates, and then give you natural dietary information and information on what you need for specific nutrients, because we do tests to find out what you need as an individual. If you're interested in those programs or anything else we do, the CRP formula, give us a call at Body Chemistry Associates. The toll-free number is 1-800-CHEMIST, 1-800-243-6478. On the web, 1-800-CHEMIST.com. Jay Foster for Body Chemistry Associates and Health Connection Radio. Be with you again on a future podcast.